later. Perfect. It's 2 o'clock. We're starting, okay? Wait, 1 more minute. So,
Luis, would you rather us be on mute while we don't speak, or what do you prefer?
yeah, I guess that's better. Good afternoon and welcome everybody to our 7th installment of Pandemia, the series of webinars about COVID-19 and COVID-19 vaccines, brought to you by a collaboration between the COVID-19 Prevention Network and the Latino Commission on AIDS. My name is Luis Alberto Mares. I am the Director of Community Immunization Programs at the Latino Commission on AIDS, and today I will be your host and your moderator. Today's webinar is titled, Does the Fight Against COVID Really End? Y ahora qué? With this, we wanted to talk about where we are now. We have lived all this pandemic for over a year and a half now, and we have seen so many changes, like from the beginning, the uncertainty that we had, the wait for the vaccine, when the vaccine rollout came out, all the hesitancy of certain groups of people about the vaccines and the side effects that appear, and the efforts of the government to vaccinate everybody. And we still have not reached where we want to be. We are not yet close to the numbers of people vaccinated that we want to be. And aside of this, we also have witnessed the appearance of new variants of the virus, which make it more difficult to control this pandemic. To talk about this and their experience working with patients of COVID and centers of COVID vaccination, today we have 2 presenters. Dr. Katya Corado will be the first presenter. She joined the Division of HIV Medicine at Harvard UCLA Medical Center in 2012. She's a graduate of the David Geffen School of Medicine at University of California, Los Angeles, UCLA. She completed her internal medicine residency at Harvard UCLA Medical Center and her infectious diseases fellowship at the University of New Mexico School of Medicine. Dr. Corado provides primary medical care to HIV patients at the Tom K Clinic in the Long Beach Comprehensive Health Center affiliated with Harvard UCLA. Dr. Corado also teaches and participates in research at the Harvard UCLA Medical Center. Her research includes clinical trials focusing on adherence to pre-exposure prophylaxis PrEP in HIV and methods to optimize longitudinal follow-up while in HIV care. Most recently, her research has focused on COVID-19 vaccine trials as well as treatment trials. She is passionate about giving her Latinx community a voice and ensuring communities that are largely marginalized and underrepresented in clinical trials also get a chance to participate. And today we need to make a last-minute change for personal reasons. Claudia Pineda, who appears in the flyer, couldn't be here with us today, but we have Emmy Estrada, who works with Claudia. Emmy Estrada, BAC, born in Guatemala, received her first degree in history, and then proceeded to earn a second degree as a physician assistant. She worked at George Washington Hospital for a while and had practiced in pediatrics, ER, orthopedics, and currently primary care. She has made her priority to work with the Latino and Black communities because she knows how hard it is to find healthcare providers that do not know, understand culture, nor language of this community. When the pandemic hit us, she decided she wanted to help out as much as she could and came to New York to work with the first wave of patients in Coney Island at the beginning of April. After 3 weeks in the makeshift tent, she went to work for testing sites. I got on help and eventually ended up staying there and started to work in the CI medical care. So we're starting the webinar right now. Please write your questions in the question and answer box for the presenters that we can read at the end of the presentation. So Dr. Corado, you can start sharing your screen.
Sure, sharing my screen, okay. Or I thought, So Luis, thank you so much for having me on today. I hope it's okay that I'm just going to talk a little bit through what the experiences has been. And so I don't have necessarily a PowerPoint I want to share because that does tend to get a little bit boring, I've been told.
That's fine.
I think we all understand that for us to fight COVID, we have to attack it in different ways. We have to prevent, we have to treat, and then we have to do what's called prophylaxis, right? This we know in terms of HIV world, because we've talked about pre-exposure prophylaxis, post-exposure prophylaxis, say when we get when we have an encounter with someone that has HIV. The same thing we can talk about when it comes to COVID. So as we know, the first part, which is prevention, which we have done for the last year and a half, which is wearing our face masks, watching our hands, keeping socially distanced. And now we have the vaccines, right? So our clinical trials, that is when we have a medication or a vaccine that needs to be proven if it's gonna work and if it's gonna be safe, that has been occurring since the beginning of the pandemic. And we know now that at least the 3 vaccines that have EUA approval by the FDA, so the Pfizer, the Moderna, the Johnson & Johnson, we know that it's safe and it works. So we have prevention down. But of course, for many reasons, there are people who may not want the vaccine or may not react well to the vaccine, people who don't mount enough of a response. And so for those people who are still getting infected, we need treatment. And right now, the big focus for many of us who do clinical trials is on treatment for COVID-19. So we want to be able to give you a medication that you will get when you start having symptoms of COVID-19, but before you get sick enough to go and get hospitalized and hopefully not die. So that is currently, we're working on many projects across the US and worldwide to study different medications for this purpose. And finally, some of these medications will also be used for the for prophylaxis. So for those who have been in contact with someone who has not yet developed symptoms, so we give a medication to prevent symptom development. Again, very much like PrEP for HIV or PEP if you are in the NPEP or PEP if you're exposed and need medication afterwards. So in all of this, I would like to say that for the clinical trials, so for to study if this treatments work or not, we have to make sure that our population, our Latino population, are represented. One of the big reasons why is because our Latinos are the ones who are dying. Our Latinos are the ones who are getting infected and having bad outcomes. And so if we have a treatment that I know, say 30% of people in the clinical trial were Latinos, I can tell my patient, my 56-year-old Latina patient, I know this medication will work on you because it has been studied in people like you. So that's the reason that our representation is very important. Luis, I'll stop there because I don't want to dominate the conversation, as I know others, Emmy probably has a lot more to say.
My turn? No, please.
Thank you, Dr. Corado. So now we continue with Emmy and her experiences working with patients and centers of vaccination here in New York about COVID-19.
Hi, buenas tardes, buenos dias. Thank you so much for having us. I apologize for the last switch up, but thank you for having me. So as you mentioned, we work in a primarily Spanish-speaking community. We're in Sunset Park, Brooklyn. And we get a lot of the hourly wage workers, which are primarily uninsured. And so that has been the predominant in terms of demographic, in terms of our COVID patients. Claudia's office was the only one that stayed open throughout the pandemic when it hit in New York. So while everyone generally closed in March, she was the only one that stayed open. They were seeing up to 100 patients a day, to the point where the lines were literally around the block. They had to get tickets so that they could guarantee treatment that day. A lot of the ERs were turning our people away, unfortunately, because either they weren't sick enough or I know, the unsaid, the uninsured. A lot of people were being turned away. And so thankfully, Claudia stayed open. She did the best she could. She was working with our attending physician at the time, who has contacts in Wuhan. And so he was in contact with the physicians that were treating patient zero, actually. And so based on his guidance, she was able to really create her treatment plan for a lot of the COVID patients which came in, which a lot of it consisted of IV, IV fluids, hydration, things for the nausea, the pain, all that stuff. A lot of multivitamins, which we all know we believe in Complejo B, a lot of that. And so that was sort of the way things happened here. Fast forward to when the vaccine became available, we had a lot of patients who were asking us, are you getting the vaccine? And of course, we were like, absolutely, no doubt. But we had a little trouble at first. We were able to get vaccinated. Once we were vaccinated, we noticed that people kept asking us, did you get the vaccine? Yes. How did it react? Yes. Are you getting it in the office? And we were trying every day. We were ordering to the city our order for vaccinations. And it was always on back order. But patients were like, I'm not getting this vaccine unless I get it here, unless you give it to me, unless the people that they know are MAs or medical staff who they trust, unless they were the ones giving it to them. And so thankfully we were able to vaccinate it. We ended up vaccinating it with between 500 and 600 total, first and second doses, which was pretty great. And so we have a good majority of our patients are vaccinated, I will say. However, I will say right now, like she said, our struggle right now is those who aren't quite convinced on vaccination. And how do we convince them? A lot of it is misperception, false information, as we know. And so Claudia and I have really been working towards, what are your questions? How can we address them? We encourage them to read the actual scientific literature. We'll give them resources. And from the fact that we were vaccinated, we can tell firsthand, well, this is what I experienced, but this is, it was temporary and I feel so much better. And it's a nice layer of protection. So it's a constant struggle, but it's been really amazing to be with this demographic, right? Because they know us, they trust us. And if we say, trust me, it's safe, maybe you'll feel a little uncomfortable for a day or two, but it's totally worth it. We've had good outcomes, but we've been working hard on trying to convince those who are sort of on the edge still. Mm-hmm.
And Luis, if I can add to Emmy's story, which is really powerful, and we're so thankful to have clinics like that that remained open. So as someone who, so in my work line, I do both clinical and I also do research, right? So in my clinical world, I'm not only in the clinics, but I'm also in the hospitals, seeing patients in the hospital. And I can tell you that many people, many of those of us who have been in hospitals treating patients with COVID-19, it really, and unfortunately, we're talking about where we are now, and where we are now is starting to look like where we were back in December and January, when we had this horrible winter surge that I can only describe when we were at the hospital as really a battle zone. You would walk through the hallways, every inch was covered with patients who were needing oxygen. When I would walk into a room, we had, for example, rooms that were converted to 4-people room because we needed space. You would walk in and you'd see all the patients, all Latinos, because again, I work at a county facility, Latinos who were hooked in with their oxygen and just staring at you, for help. And unfortunately, at that time, we don't have much to give. We didn't have much to give. So after that experience, I took some time and I actually volunteered at a mass vaccination site because I really needed to see what potentially protection would look like. And it really made such a difference for my own mental health after going through what I felt was a battlefield experience, to be in a position where we were able to offer what is really life-saving interventions for people.
Thank you, Dr. Corado and Emmy, for sharing your experience with us. There's a question here, I think it's for Emmy, is what was your experience like with COVID-19 in New York City last year when you came to New York to work in the COVID-19 centers?
I came, it was one of those things that, forgive me, it an agency that was like, hey, we need people. So I signed up within 48 hours. I was like, this is it. This is what I've been waiting for. I want to do this. This is why I got into medicine, right? To help in a time of need. And so I was able to deploy within 48 hours, initially at Coney Island. They put us in the tent, which they had created because the admissions were so high. They didn't really know what to do with all these extra bodies. So they actually, I was one of about 10 providers that were placed in the observation unit. It was really hard because I think as a provider, anyone in medicine, we get into this because we want to help people. We want to make them feel better. And when you're there and you're watching a patient struggle, and it's almost like you do everything you can with the oxygen, and you've done everything you know to do, but they're looking at you like Dr. Corado says, that was really hard. I think we talk about this all the time with Claudia. A lot of us, it took a toll on us mentally, because there's nothing worse than seeing your patient look at you and think that you're not helping them when you're really doing everything you know to do, you know? And so I completely understand what that could have felt like. And so that was the first 2 weeks, you know. Researchers were thin. No one wanted to come into the tent because it was the COVID tent, you know. So something as simple as getting a chest x-ray, CAT scan, no one wanted to come in. And so that was really difficult. But we did our best what we could for our patients. And I know, I guess you push through because you're here for them, you know. Once that, thankfully within the 3 weeks, the tent closed because the admissions had gone down, and then I started testing for the city. And then that was another opportunity to work with the community, because I got to really talk to them and hear about their experiences. This was in about end of April when they opened the tent, and I was still hearing stories of families. Hey, I came because my whole family, we live in the same room and there's 8 of us. And one of them got sick, and it's like a domino. Right now, the other person is sick. They're telling us stories about their uncle who just was so scared to go to the hospital because they thought by going to the hospital, you're actually going to die. So they wouldn't go to the hospital. And we have a lot of patients who have siblings who passed, or uncles or tios, anything that passed away in their own apartments in the homes. So that was really hard to have to deal with. And then I thankfully came upon this opportunity with Claudia, and it was just everything all over again, you know. What we noticed is that a lot of these patients, because they're laborers, a lot of them don't get routine medical care. They don't have insurance. And so a lot of these patients came in very sick very fast because they had comorbidities that were undiagnosed. Diabetes, high cholesterol, high blood pressure, all those things. And so on top of treating this acute illness, now we have to treat this chronic illness that has been uncontrolled, you know. So I would say overwhelming, but it's been a really humbling experience. And I think I'm just grateful that I could be here, because Claudia was doing this alone up until August. And then thankfully I jumped, you know, we found each other and I was able to help her. But I'd say rewarding. But I, like Dr. Corado says, we still have a lot of work to do, because we still have a lot of people who aren't getting vaccinated. We have been getting a few people trickling in the last 2 weeks with this new Delta variant. Out of the 6 or 7 that we saw, only one of them was vaccinated, and they were asymptomatic, and it was just they came to get tested because someone got sick. Everyone else was pretty sick. One of them is still in the hospital on oxygen. A couple of them asked for the vaccine on site, and we're like, we can't give it to you right now, but either way, I'm sorry, it's too late, you know. So it's one of those things that we're just still trying to do our best to educate them, because even patients now, I ask them, why did you get the vaccine? And they're like, I wouldn't wish that on anybody. Do you know what it's like to be breathing and to actually be feeling like you're drowning? They're like, I wouldn't want that on anyone. Of course I want everyone. Anyone that I can convince, I'm telling you, get the vaccine, it's worth it, because it's protection, you know? And so, yeah, Dr. Corado, I'm sure you have a lot to add.
There is a question, I think, for both of you. Is when you were working in New York and California with the communities in receiving services about COVID-19, were Latinos able to find the help that they needed?
It's really hard to answer that question, because there's not much help to give, right? So when you are already infected and when your body is going through the inflammatory phase. So in general, for everyone to understand, when people get infected with COVID, about 85% will do fine. They will do fine, you'll get a fever, you'll feel horrible, and then you'll be fine. It's the 15% of people who don't do fine that we see at the hospital. And it's 5% of those who end up not doing well, i.e. they have to have a breathing tube, so ventilated. And most people who get ventilated end up passing away. So what we are learning is that 15% of people who don't do well go into what is called this inflammatory phase of COVID. So some of us may understand this as, for example, when we do AIDS treatment, right? Say you come in and your CD4 count is very low. We start you on medication to get the virus under control and your CD4 count to come back up. Some people will go through something called immune reconstitution syndrome, which is an inflammatory syndrome when your body basically wakes up. And some people have a very difficult time for that. Kind of the same happens with COVID. A certain number of people, and it has nothing to do with HIV, go through an inflammatory phase where your body, the virus may not be alive anymore in your body, but your body is going through this, like, I don't know what to do, and everything is just super inflamed. And so when they get there are very, very few things we can do. There are some medications that we try that we give to kind of, like, for example, corticosteroids or this monoclonal antibody called Toci, that we try to give at that time to calm down your body's response. But in general, people are coming in very late, as Emmy is saying, and so we're catching them at the tail end. So it's hard because, again, there's not much to give. But the other side of that is the sadness that when right now, in people who have elected or for some reason have not gotten the COVID vaccine, when they come in that late stage and you know that there's not much that we can do, it's horrible because you think, had they gotten the vaccine, this could have been preventable, right? So the thing to do is, in the prevention mode, is not so much once you get sick, you need to be hospitalized.
Thank you. There is a couple of questions that are related. Alejandro Santiago, he wants to know how you doctors feel about the third booster shot for immunocompromised patients, specifically HIV. And Yuri Velasquez is also asking about that the FDA is proposing a booster shot. What is your opinion on this? And how will you convince someone who hasn't even received the first round to go to a round of 3 vaccines?
Emmy, do you want to start first? Or, oh, okay, you're on mute.
Sorry about that. So, you know, I've been keeping up a little bit, obviously, because this is a very important question a lot of our patients are starting to ask. My understanding is that this research is still under peer review, if I'm not mistaken, in terms of the data. However, you know, I think at the end of the day, what I tell patients is I really do believe in vaccinations. I believe in the science behind it. And if you have a group of scientists who truly believe that those who are the most vulnerable, which are immunocompromised, would benefit from an additional dose, we absolutely endorse it, you know, and I think that's our bottom line with Claudia at all times. We believe in this, you know, otherwise we wouldn't have done it ourselves. My nephew is 14, he has his Pfizer shot. Thankfully, he's there. Anyone who's been able to get vaccinated in our family has. And so that's been our stance, and that's sort of, I guess you could say, our push.
Yeah, and to add on to that, so boosters are not new, right? Boosters we do for so many different types of preventable infections. So we get our yearly influenza vaccine. People don't, usually don't make a big cry about getting their yearly influenza vaccine. Every 10 years, we get our tetanus booster. And so there's different, we get a pneumonia booster, right? For meningitis, those with HIV, you got your first shot and then you got your booster shot 2 months later. And so the idea of booster is not foreign to us, to our population. And so what the studies are showing is that what we really want to see is the level of something called neutralizing antibodies. So that's what it's in our body that actually really help fight COVID-19. So over time, we expect those neutralizing antibodies to go down. And what we're starting to learn is how low is too low that the protection is no longer there. Because once we get there, we want to give another boost to get your immune system to come up. In general, when you have HIV and your CD4 count is below 200, your body is not considered very strong, right? That's why all of us always want to put you on medications to get your CD4 count above 200. And so when you're above 200, we're not as worried about you, which is wonderful. So for those who have HIV, specifically those who have a CD4 count less than 200, I would worry about your initial response to the vaccine, meaning that I would worry that you didn't have enough neutralizing antibody to begin with. And once the FDA says absolutely a booster is needed, I definitely think it needs to be done, especially in those with CD4 counts less than 200, right? And so it's about looking at the data, it's about looking at the science, and we go by that standard, nothing else.
And may I just add, it's interesting that you say that, because I find that a lot of people who are hesitant to get vaccinated, they just come back to get their antibodies measured because they were like, oh, do I have some? Oh, okay, cool, I'm gonna wait. And they were like, well, it's like barely considered a positive, but the fact that they even have any gives them a sense of security. And so part of our struggle has really been because, when we see someone who hasn't vaccinated, the levels rise significantly. And we always say, well, don't you want to have more than just a little bit? It's more protection. And so that's one thing we're seeing is people are like, they just come back every few months, measure them. And if they still have any, they're like, I'm just going to wait until they go away. So that's also been a battle for us as well, is to try to convince them.
Yeah, especially, Emmy, as you probably know, those antibodies don't mean that they're protected, right? And so having antibodies, in general, antibodies doesn't mean that you have neutralizing antibodies. And so you can be antibody positive for years. It doesn't mean that you're protected at all.
Exactly. Again, it's a lot of it is you have the information of science at your fingertips, and so they're like, oh, antibody means I have protection. So that's definitely part of the battle right now, I think, with misinformation.
Now it's Paulina Monteon Garcia, she asked, what resources do you ladies and your staff provide to those community members that are hesitant to get the vaccine?
Dr. Corado, would you like to go first?
So all the resources available in whatever language is needed. So, I mean, thankfully, as an infectious disease physician, so like my job is to know all this stuff, and my job is to be able to talk to my patients about the details of the stuff. And then I usually guide them to the CDC website, which has a lot of wonderful information in different languages. What I often say is, always be careful about where you're getting your information. So for example, I know we're on Facebook Live, but Facebook, as we know, may have a lot of information that is not quite true, as other sources. So for example, some patients of mine, and I have a majority Spanish-speaking patients, they come in and they're like, oh, doctora, ¿no vistes que la actriz de Mexico está posting this stuff? And I'm like, let's not put so much confianza in what someone who doesn't either have a scientific background or some sort of knowledge of what is happening in terms of what they're saying. So for me, I always route people to the CDC website.
Absolutely. I definitely would say CDC. I also encourage them. I found in the community, same thing with social media, right? You have a lot of articles here, someone said this. I think with the recent political change, people have this perception that there's a political influence of the CDC decision making. And so while we always push the CDC guidelines, we started encouraging also other medical journals, New England Journal of Medicine, Harvard Medical Review, JAMA. And I'll give them the links. I'm like, read, they have weekly, monthly updates on the studies on vaccination efficacy. And I'm like, please, and I always say, please don't click on the link and think that that's correct, because chances are it's not. So that's, like you said, it's part of the battle, is just encourage them not to look at these links, but to seek these real sources. And so we tend to defer them CDC and then just medical journals where they feel that, where they can get scientific data, like you said, which is what we really believe in and what we go by.
Absolutely. It was a difficult task last year when we had the president of the country saying things against what the science was saying. So Lady Usuriaga, she says, I'm a patient with asthma. My question is, can I ask my doctor for a nebulizer if in case this COVID continues? Dr. Corado, maybe?
Yeah.
Sure. I mean, you can ask for nebulizer, but it's not going to do very much, right? So obviously you are familiar with how nebulizer works. So when you're having an asthma attack, that means that your airways are closing up and becoming very inflamed. And what many nebulizers do is they open up your airways so they allow oxygen to come in and out and for you to breathe a little bit easier. And that's fine if you're having asthma exacerbation. Is that a treatment for COVID? Absolutely not. Can we use it sometimes with people who are asthmatic, who have COVID, who come in with their airways constricted? Yes, we can, but it's not the treatment you're looking for. You're definitely looking for the vaccine.
I agree. When people were complaining of shortness of breath, we gave them a few treatments just so that they felt relief, but it was not the treatment, so, we always believe vaccination is really the best way to prevent severe illness.
Jennifer, she says, is there something in particular that helps the Latino community understand the importance of vaccines that you have seen working, that you see it works with the Latino community? What resources or what techniques or what information you have for the Latino to understand the vaccines are really important?
From personal experience, I would say that a lot of patients had a lot of confianza when I would say, I got it too. Look, I felt a little sick. I had some headaches. I had some fevers, but nothing I couldn't manage with a lot of hydration and Tylenol and ibuprofen. Yes, it's uncomfortable, but I always tell them what are the risk versus benefits, right? And we have so many more benefits with getting the vaccine. And actually, believe it or not, I can't tell you how many times when we did have the vaccine in stock, we would talk to them, they're like, all right, I'm ready. You're right. You gave me the confidence. I'm going to do it right now. Come on, do it. And we're like, okay, because everyone's worried about allergic reactions. And I'm like, we monitor you for a reason. We are equipped with not just IM epinephrine, but IV epinephrine in case of an exacerbation. We're right here. And when I tell them that we had lots of people with allergic reactions that had no problem with the vaccination, they're like, oh, okay. So we were able to convince a lot of patients. It's just like, hey, we're going to be right here with you. So don't worry, you're not going to go alone. And if you feel sick tomorrow, come back. We'll help you, So I felt that did a lot for a lot of the Latino community. They had a lot of confianza because we were reassuring them that this is safe, not just for you, but the community.
I completely agree with Emmy. The confianza is such an important issue, right? The other thing that tends to work is when we talk about when we talk about vaccines, we're talking about two separate things. We're talking about what it can provide for the individual person, and then we're talking about what it can provide for the community. And for us Latinos who live in multi-generational families, households, where aquí estoy con mi abuelita, con mis papás, con mis hijos, right? And so when I vaccinate myself, I protect myself, which is wonderful, but I also protect my loved ones. And when I protect my loved ones, I then protect my community. And so when I was talking about our horrible winter surge, it was not uncommon to have abuelita on the 3rd floor, dad on the 5th floor. And so like people in the same family getting admitted with COVID-19 because we all live together, right? I'm making generalizations, but it is very appropriate for our community. And so when you're discussing vaccines, and especially if you're young and you're like, oh, I'm young and healthy, I'll be fine. You're like, okay, probably you'll be fine. But by you getting vaccinated, you're also taking care of that 5-month-old baby who can't yet get vaccinated. And you're taking care of your 90-year-old abuelita who may have gotten vaccinated, but she's still at high risk of having bad outcomes. That tends to work.
I actually had a 17-year-old yesterday that was like, I don't want to get vaccinated until like I have to. The mom's like, well, I've been telling you, you should do it. And I said, well, just remember, again, this is not just about you. You are strong, you're young, you can do this. This is about everybody else in your household, And I always tell them, at the end of the day, if someone gets sick, don't you want to know you did everything you knew to do to protect them? That's another pitch that we use a lot.
Yeah, and I think every Latino organization in the country have done efforts and campaigns promoting the vaccines and the efficacy and safety of the vaccines in the community. We at Latino Commissioners also have a campaign. You can go to our website and check our campaign. Another question is Joy Crossmith is asking, why are there so many breakthrough cases vaccinated and still get ill? I don't understand the question, but I think that the person wants to know why some people that have been vaccinated still can get ill.
Yeah, so that's a wonderful question, and I have a wonderful answer for you. So the vaccine trials, right? So when you actually look at the vaccine trials, what their end point or what they're looking for is how many people are hospitalized and how many people die. They're not looking at if you got sick with COVID and did fine, right? Because if you got sick with COVID and did fine, that's what the vaccine is for. What they're looking for is to see if you got hospitalized or if you died. So when you get vaccinated, it doesn't give you a what is it, a free card to do everything, because your body can still get infected with COVID. But when your body gets infected with COVID, which are called breakthrough infections, it is very likely that you won't have any bad outcomes. Yeah, you'll get a cold. Yeah, you might get a fever. Yeah, you'll have to stay home for a little bit, but you won't get hospitalized and you won't die. And this is made very clear by the most recent statistics of right now, of those people who are dying, right? 99.5% are people who are unvaccinated. So again, it tells you that you get vaccinated, you basically get protected from being hospitalized or dying. When you get vaccinated, you don't get protected from everything, right? You can still get sick, you just won't have the consequences of the disease.
Maribeth Brute said, oh, which is an opinion. You can also visit Combat COVID HCSA.gov to learn more about clinical trials for possible treatment for COVID-19. Rocio, she says, I'm not sure if you saw this comment on Facebook. I can see it from the Zoom link, but I wanted to show you. Noemi Alvarez de Gomez, are you seeing an increase in parents bringing their children to get vaccinated?
I'm so sorry. Can you say that last part again? I didn't hear it. My apologies.
If you have seen an increase of parents bringing their children to get vaccinated.
In the community, I can tell you that yes and no, simply because we just have a lot more parents that are like, where can I take my kid? Where are the resources? A lot of them are because of going back to school. They are very nervous because they have been reading and watching the news, and they know that this new Delta variant is really, it's causing a little bit of chaos, you know, and now with the kids going back to school, and then, you know, New York, the mask mandate has stood pretty firm with indoor spaces, but we have been noticing that parents, the closer you get to that back to school, the more worried they are about how realistic it is that, you know, it's not, even if they're vaccinated, or even if someone back home isn't vaccinated, they're out. Someone in there is going out and then coming back in every day, and that whole shift, the idea of shifting back to a normalcy before pre-pandemic, you can tell it's really starting to worry a lot of people, because it wasn't until I think things started to open up that I think a lot of people understood the importance of prevention, like Dr. Corado says, prophylaxis, all that stuff, but really prevention is really what everybody can really do to help each other. And so, long story short, yes, I would say yes.
Valerie Taveras, my husband was recently hospitalized for pneumonia. When the hospital tested him for antibodies, they informed us that he did not have any against COVID, even though he was vaccinated back in April with the Moderna vaccine. What could have possibly caused the negative antibody results?
I can take that one. So I get this question all the time, right? So especially from, say, nurses or other people who have gotten vaccinated and then go get antibody testing. So the antibody test that is routinely done in labs and in hospitals are not the antibody tests that are actually needed to see if you've had a response to the vaccine. That it gets a little bit scientific and a little bit complicated, but basically what the antibody testing that is necessary to actually see your response for COVID, for the vaccine, is something called the nucleocapsid antibody, which is very specific and not many labs do it. So the antibody test that is most likely done are antibody tests that were created before the vaccine was created. So it wasn't made to see the response to the vaccine, it was made to see a response to a different part of the virus. And so that's a little bit too scientific, and I apologize for it. But basically, antibody tests don't show you if you've been vaccinated or not. It's a very specific type of antibody test that you need for that to be the case.
Okay, I think she made a comment after. She said, I'm sorry, I would like to clarify that he has since been discharged, but there's still the question regarding the negative antibody results. He wonders if the vaccine will still protect him for the new variants. And thank you for your work.
Yeah, I would say, so, you know, so it sounds like your husband is discharged, which is wonderful. And I hope he was not hospitalized for COVID, or I don't know if he was or not, but if he wasn't, then the vaccine is working, right? And if he was hospitalized for COVID and has left and is doing well, the vaccine has worked. So I hope that answers your question.
Yes. Yes, I'm mute. So Emmy, you've been in New York working from the beginning of the pandemic, and I think you were here for the first high peak that we had in April, March last year. That lasted until June, I think. Many people died and many people got sick, and hospitals were like crowded. And we saw trucks with dead people on the streets. It was horrible. New York was the center of the epidemic for a while. And what we saw later, like Dr. Corado was saying, by November, December in the rest of the country. And now we are in a different stage. We don't have too many patients in New York anymore. What do you think worked well to control the epidemic here in New York to get where we are now? We're still trying to vaccinate more people, but we've been for a long time in a very steady low level of vaccination. Recently, we're going up a little bit with the Delta variant, but still kind of control. What do you think worked? What campaign, what was done that the community in New York decided to get vaccinated more than other communities, for example?
So I would say, so this particular neighborhood has a really big factory. And so you have hundreds of workers that were working side by side. And what does that mean? That when the pandemic started and we were the epicenter, I mean, you're talking about a lot of people got sick very fast, and unfortunately, a lot of people passed away very fast. One of the very aha moments for me was once we got closer to the holidays, you're seeing patients and you're like, oh, I hope you have a good holiday with your family. And a lot of times people were like, actually, my husband passed away. Actually, my daughter passed away. My brother passed away. I had a patient who had 3 members of her family pass away. And so I think, unfortunately, when you're in a community who is traumatized, and I say this all the time, our anxiety and depression rates are just through the roof now in this community. I have men, women of all ages that are coming in and they're like, I feel this way. And I'm just like, you are traumatized from what you went through. And so I think just the experience of being in this neighborhood and having witnessed that, just to know, I can assure you that most people in our practice have someone that either had COVID, was hospitalized for COVID, or passed away. And I think that alone in this community was enough to traumatize a lot of people to think, no, I'm going to do my part. I'm going to do everything I can to make sure this doesn't happen to anyone else. And like I said, I have a patient who says, I wouldn't wish this on anybody, what I went through. So she's like, I'm over there trying to convince my kid who's grown up, and I want them to do it because I'm like, don't trust me, you don't want this disease. So I would say a lot of it is simply the experience of this community and, you know, our comunidad, word of mouth, right? Tal fulano, mi vecina me dijo esto, fulano, no sé. They trust the community, they trust the people here. And if, you know, Claudia and I think we have been very blessed with their trust. If we say, yes, we believe in it, do it. We've been very fortunate because they're like, okay, let's do this. So I would say, you know, it's a very unique situation in this neighborhood because of that.
Yeah, I live in New York, and I would have to add that I see people on the streets, and the subways. At the very beginning, we were like confined in our apartments. We didn't go outside. The streets were really empty. Now that we are going out, people are still wearing masks a lot, especially when you go inside the markets, the stores, restaurants and centers, and also on the subway. You go to the subway, 99.9% of the people are still wearing masks in New York. And I think that's something that was told to us many, many times, so people learn. And I think that's a big factor that has helped the city and state to control the epidemic in a way.
And Luis, can I add to that? Because the mask wearing, right, as everyone understands, the mask wearing has become such a controversial topic. And what I think most people don't understand is that when you wear a mask, you're not really protecting yourself. What you're doing is protecting everybody else around you, right? So for example, if I have COVID-19 and I walk into the subway, by wearing a mask, protect everybody around me from getting my COVID-19. It's not that I am protecting myself from everybody else, but there is obviously a layer of protection from everybody else. So the mask wearing, and many of us who continue to wear our mask, even if we don't have to, including myself, you wear it because you are being protective of those around you. People who pass by me in the store, I don't know what their immune status is. I don't know if they've been vaccinated. They don't know that I work with COVID patients every single day. And so if I wear my mask, it's basically saying, I am protecting you. I love you. I don't want you to go through what I've seen, right? It also, and I should clarify, it also protects you as well. So, we wear it for our own protection, but even more, it protects the other person. So for people who are saying, well, I don't want to wear a mask because it's my freedom and blah, blah, blah. And that's fine. It is your freedom. But your freedom may be causing someone else to get sick and someone else to die, right? So it's about evaluating, well, what's really worth carrying that on your conscience for the rest of your life versus just putting on a mask when you go inside to a supermarket.
Yes, absolutely. There's one question here. Maria Gutierrez asked, what have you both done for yourselves to help cope with this traumatic experience?
I was going to say a lot of crying, but that's not what people want to hear. So, and apart from hugging my dogs and my husband every single day, it's really about, so number one, getting vaccinated for myself, getting my family, actually, because I'm the only doctor in my family. And so getting my family to participate, I'm talking about my mom, my mother-in-law, my husband, to participate in the vaccine clinical trials, because I knew they weren't going to have access to the vaccines until much later that I was going to have access to the vaccines, getting them to participate. And thankfully, for example, both my mother and my husband participated in the AstraZeneca COVID clinical trials. And both of them, when they were able to see if they got the vaccine or the placebo, both of them have got the placebo. So both of them have been protected since October, last year. And I got my COVID shots in December when it was for healthcare providers. So making sure that my family is protected, making sure that I do as much as possible to do events like this, to tell my community how they can get protected, even before vaccines were available, was really important to me. And then also, self-care, which Emmy can probably agree with me that we don't do nearly enough as we talk about people doing. But again, exercising, eating well, being around loved ones, your family is what's really important to me.
I definitely agree. I would say that one thing I realized when we first came out for the pandemic is this gentleman that was training service dogs came by to the hotel we were staying at and brought the dogs with him, and just to say hi. And this was 6 weeks I had been here, and I went to hug the dog and I just started crying. I didn't realize that no one had hugged me. No one had touched me at all in 6 weeks. And I was like, oh my goodness. And you just realize how important, like you said, self-care is, right, during this process. Because we do everything to the best of our abilities. So for me, it was talking to my family every day. And like you say, taking care of yourself, doing what I knew was best, which was wearing my mask, getting vaccinated, my family's vaccinated, educating anyone who has answers. And ultimately trying to sleep, because sleep was hard. I'm sure Dr. Corado will agree. Sleep was really hard at first when you're just thinking about everything. So it's taken a lot of practice and discipline, but thankfully, I think just taking care, again, just being with my family, people I love, talking to them constantly, working with my patients, I think has been self-care in itself, and just feeling like, they know that we're there for them. That's a lot as well.
A question about mask. It is necessary to change masks daily to mask lose effectiveness if washed daily and reused. This question is also related to a person who is vaccinated.
So there are different types of face coverings out there, right? So there's the cloth masks, which come, depending on the cloth mask that you buy, can come with different, thread numbers. There are the face masks, that usually the blue mask that you see, say, when you go to the doctor's office or when you go to the clinics or the hospital. And that is actually very good, high quality. And then there's others like the N95s. But in general, for our community, we're probably going to be using face masks that are cloth-based. As long as your mask maintains its integrity, so it doesn't have holes and it gives you a good seal and a good protection over your nose and underneath your chin, that is how I would wear it. Now, in terms of cleanliness, it would be ideal to wash your face mask every day. But most of us know that that doesn't happen, right? Because the face mask gets hung on the car door or on other places that we just grab it and reuse it. And again, something is better than nothing. And really, by reusing the face masks is about the bacteria that lives in your mouth and comes out and can cause skin issues. Not so much affects the integrity of the mask as much. But I would say if you're washing your face mask twice a week at least, that is much better than not washing it at all. And as long as it's maintained the integrity. One last thing about face masks, what I often see people do is wear their face mask here, right? Where the face mask should really cover the nose and the mouth, not just the mouth. And so if you're walking around with your face mask, but you have it here, it's not doing very much, right? So we have to make sure that it's covered in the appropriate area.
There's no more questions, I think. Maybe one more here. Let's see. I work in the Bronx hospital that was hit hard with COVID-19. My patients with HIV have jumped at the chance to get the vaccine, and the others don't get it. It's hard to continue to convince those patients saying no to the vaccine when some of our co-workers are also saying no to the vaccine. I know changes are coming with the mandate for healthcare workers to be vaccinated in New York City, but it's getting harder to try and remain positive with patients and co-workers who continue to refuse the vaccine, knowing how bad it was here. What are some other ways to have these discussions with them without burning off the last of one's empathy?
That is the $1 million question, right? Because all of us who work at healthcare facilities, there's a portion of us who are not vaccinated. So for example, I work at the Department of Health Services, which is a county facility here in LA County. And the recent statistics is something like 95% of the doctors are vaccinated. And then it drops off to 70% of the nurses are vaccinated. And then it drops off depending on what you do. And it's extremely frustrating because we want to encourage our patients to get vaccinated. And like Emmy said before, one of the biggest and strongest things is to say, hey, I got vaccinated, my nurses got vaccinated, you'll be fine, right? You can sit here with me and get your vaccine and I'll watch for the next 15 minutes. And so letting them know that you went through it so that they're not the guinea pig or they're not the first ones to get the vaccines when we know so many millions of people have gotten it is actually really powerful. It's again very frustrating. For my panel of HIV patients, thankfully the majority of them have gotten the COVID vaccine, probably because they have me as their doctor and I won't let go of it, right? So just to get me to shut up, they probably got their COVID vaccines. But I totally understand that for the few that haven't, that's the few that keep me up at night, because if they do get infected, chances are that they're not going to do well. And I don't have the magic answer. It's just, I think, and I'm not saying that you're being judgmental, but it's hard to fight that frustration and anger that you have when you've seen all the bad things that COVID can bring, and knowing that the person is turning down the one thing that can be really helpful. Yeah. I wish I had a better answer.
I spray my face mask with isopropyl alcohol when I take it off. Is that safe?
So actually, it's not unsafe. It's probably, so I'm assuming your face mask is a cloth mask. It's just, how to explain this. So the actual virus, when it hits your cloth masks, it actually disintegrates. So it doesn't live on your cloth mask. So spraying your cloth mask for COVID purposes is not going to help. I think soap and water is the best thing to clean your face mask or your cloth mask, specifically because you're getting rid of the bacteria that you yourself have gotten on there. I don't know what level of isopropyl alcohol is toxic to someone, so I don't want to answer because I don't want to lie. But I wouldn't do that. I don't do that.
Yeah, I don't do that either. I wash them or the discountable ones, just get rid of it. Any advice for those who like to travel, road trip and airplane?
I'm so sorry. Can you say that one more time? I'm having trouble hearing.
It is any advice for those who like to travel, road trip and airplane?
Oh,
I can start.
yeah,
Emmy.
I was like,
So yeah, it makes me sad because I also love to travel, and there's family that I have in Brazil and Peru and Canada that I haven't seen in a while because of COVID-19, right? And so so wearing your face mask while you travel is really important. Airplanes, thankfully, how their air system works, their air system filters the air very frequently. So it's not like you're stuck in a box with no air, right? So it's likely going to be safe in an airplane. But where we are not safe is when we take our mask off to eat and say we're sitting next to a passenger and the passenger coughs and we're right next to one another with our face mask off and eating, right? So that won't be safe. I think traveling to places or countries that are currently going a surge is not the best idea. So I would put that on pause until things have calmed down. And obviously, if you are vaccinated, it really gives you a whole slew of protection. You still have to face masks, and I still wouldn't travel to countries with high outbreaks or places with high outbreaks, but it gives you that level of confidence that if you do get infected, you'll probably be fine.
And I think we're done. There's no more questions. Thank you very much, Emmy, and thank you very much, Dr. Corado, for being here today in our 7th installment of Pandemia. And I invite everybody to stay alert for our 8th episode next month, probably. And well, that's all for today. Thank you very much.
thank you so much.